Los Originales Community Health Worker Radio.
Hey, welcome. You are in the circle. Welcome to the social circle every Friday at noon, lunchtime. You can grab your lunch. You can eat with me. This is a bilingual show, so sometimes we're in Spanish, sometimes we're in English, and today we're all in English. We are talking with a very special guest today. We have Krista Rietberg here with us. We're going to do our third and final installment of COVID-19 vaccination myths. Super excited to have her here with us. But first, of course, we got to introduce who we are and what we're doing here. We are a community health worker coalition for migrants and refugees. You are watching Los Originales CHW Radio, and we want to announce something very special. Speaking of vaccination, we are pairing up with Uber to provide free rides to and from your vaccination site. This is also open to folks who want a ride to and from a community event where you might be getting some health education or you might be able to get a vaccine there. If you're interested in this, contact Jacqueline 206-291-2599. You can call, you can text. Jacqueline speaks English and Spanish. If you only speak Spanish, you can call Martha 240-551-8969. Please share this information far and wide. Let's make sure that access is not an issue for folks and that at least transportation can be covered. So make sure you get this information out there. Very special, awesome program, and we're happy to be doing it. So today, third and final installment, vaccine myths. Hit the share button, share this around with your networks. We need to talk about vaccine myths. They are all over the place and they're growing. It seems like there's more and more every week. I think a lot of that is when folks are arguing a position, they might not always just be concerned about one specific thing. It's more that they just don't want to get vaccinated at all. And so the arguments and the myths keep growing and moving around. The goalpost keeps moving. So these are popping up everywhere. They are popping up everywhere, and there's more and more every single week. So we really appreciate having Krista Rietberg here with us today. Hello, welcome to Los Originales.
Hey, thank you for having me.
Yeah, appreciate you being here. So can you tell us a little bit about what you do for work and where you work and what your background is?
Excellent. Yeah, sure. So currently I work at Harborview Medical Center as an infection preventionist. So part of my role is to manage disease control in the hospital setting and make sure that, manage disease control outbreaks, making sure that our patients and our staff are kept safe. Prior to coming to Harborview, I worked for Public Health Seattle King County as a communicable disease epidemiologist in the vaccine preventable disease immunization program. So I have an extensive background in communicable disease with a strong focus in vaccine prevention. And have kind of taken those kind of two worlds and come together. Whereas an epidemiologist, I was doing investigations and looking at the health of our greater community. And now I've sort of narrowed that down a little bit to look at it from a hospital perspective. So I kind of get to see the big picture, the hospital perspective, and then all the way down to the patients and families.
Right. And those social circles. So it all expands, right? So you have the family units, and then you have these community units and the schools and the hospitals, and then it goes all the way up and up and up to all of our public services.
We are all so connected. Mm-hmm. We are all so connected.
Yes. And if there's anything you can take away from the pandemic, that is a big one. Definitely Absolutely. All connected. Yeah. So what are you seeing in terms of vaccine myths in your work? How is this showing up in the work that you're doing out in the community?
Yeah. So some of the things that we're seeing now, I could take a step back. Thinking about the beginning of the pandemic, before we had a vaccine, when we were still trying to figure out disease transmission, we were trying to make sure we had enough supplies for healthcare workers before we started recommending masks for people in the general public. We had high numbers of hospitalizations and really were overwhelming our healthcare system, overwhelming our healthcare workers, delaying your routine surgeries, people who had, a routine surgery where all those things were getting delayed because we just could not make space in our hospital to accommodate all of those. And generally, the people we were seeing in our hospital were people with underlying health conditions who are already, pretty sick to begin with, or the elderly. And we lost a lot of patients early on, and it was very hard for everyone, including our staff. Now, what we're seeing since the vaccine has been widely circulated is much lower numbers of COVID hospitalizations, but the people that we're seeing are extremely sick and they're young and they're almost exclusively unvaccinated. And we're seeing low numbers right now. And I don't know if people are aware of this, but the hospitals in King County and especially Harborview Medical Center operate above capacity on a normal day. And summer is very busy for us with traumas and things like that. So the idea of another surge possibly coming, especially around this new Delta variant, is very alarming to, for everyone who's in healthcare, and the concern that we're going to be able to care for all of the patients that may need our help, and also keeping our staff safe from this new, more highly contagious variant. And I think this is what's being seen in the community too. When you look at the numbers from like Public Health Seattle, King County, the numbers that are younger people and they're unvaccinated.
Right. That's a really good thing to drive home, because I think one of the myths is that this is only going to affect older folks and people with pre-existing conditions. And we can talk a little bit more about that. This picture of you was in the Seattle Times. And it was so interesting to look back on this, because this was from an article talking about the second case of COVID in King County. Do you want to talk a little bit about this picture?
Yeah, I remember thinking back during that time about how stressful that was, and little did I know that was probably the easier times of this pandemic. But the picture here is myself and another nurse who are getting supplies together to do home visits for testing. So at the time when COVID was very new to us, we were working very hard to keep people with potential COVID or COVID positive patients out of our hospital, unless they, of course, required that level of care. So we had a team, we called it the HAT team, the home assessment team, that would go out to people's individual homes and provide COVID testing and a visit with an infectious disease doctor in their homes to evaluate, whether they needed to be seen and if they were truly positive for COVID.
Wow. So that was really early community health work. Like, you were out in the community going to people's homes really early on.
Yep. And we were at that time, we didn't completely understand the transmission. So we were going out in, our full PPE, we were bleaching our shoes, we had red biohazard bags. So we were quite the scene when we showed up, but we really wanted to try to keep COVID out of our hospitals and make sure we got as much rapid testing done as we could.
Amazing. Well, you've done a really important work, and obviously you've been there since the beginning. I mean, we have photographic proof that you've been there since the beginning.
The very, very beginning.
Wow, that's amazing.
I will say we started before it became really well known in the United States. Harborview puts out a weekly newsletter of just sort of what's going on in the world. And I had taken on that responsibility of pulling that together. And I mentioned to John Lynch, who's the head of our infection prevention program, I said, they've got these unusual cases of pneumonia in China. I'm like, do you think it's worth mentioning it in our newsletter? And he's like, yeah, put it in. And then all of a sudden the tides just turned, and it became very, very evident that we were going to have to be dealing with a situation here.
Right. Yeah, it's funny how the realizations came in waves of what was going on.
Exactly.
Yeah, very intense.
Exactly.
Okay. We have Dr. Ileana Ponce here with us. Welcome, Krista, to Los Originales CHW Radio. Yes, please follow us on Facebook. We're also on YouTube and Twitch. You can always go to our website. Scrolling at the bottom there, we have chwcoalition.org. Make sure to follow us everywhere you can so you can stay up to date with the latest in community health news. Community health is so important. Melissa Lázaro says, welcome, Krista. The social circle es lo máximo. Melissa, gracias. Thank you for being here. Awesome. Yeah, so today we're doing a very special episode of the Social Circle. Normally we would talk about emotional health and relationships and mental health every Friday, but we've been doing these installments on vaccine myths. And I actually think that is part of social health in the way that we talk to each other and what we say to each other is a big deal, makes a difference, and it is part of community health. So these myths that are circulating, let's go ahead and start diving into what they are, what we're hearing around, maybe from our families and friends, even, just people we meet or see on Facebook. Myth number 1, the COVID-19 vaccines were created too quickly.
Yeah, this is a really common one. And I'll even admit in the beginning, I was a little bit nervous about this. From all of my experience with vaccines and vaccine development, they take a really long time to get from, where the early studies and vaccine trials to actually getting into people's arms. But what I grew to understand and learned is, this research has actually been going on for decades. We have been in public health, we have been planning our response to a pandemic forever. I always say, as an epidemiologist, I've been planning my whole life for this. This is what I learned about in school. This is what I've been doing, for the past 23 years, is preparing specifically for a respiratory virus pandemic.
Wow.
So this part's not new. The technology and the science behind like the messenger RNA vaccine is also not new. This is all coming from many, many, many years of research where scientists and researchers are looking back at other coronaviruses like SARS-CoV that was in 2002 and MERS in 2012. So folks have been working on this for a really long time. We were able to pull this together. This is unprecedented. And I know that word unprecedented has been used so many times during this pandemic, but we've never really been in a time in our, recent history where we have had this emergent need with all of these global resources that could be pooled together to create something really quickly. With a lot of global funding, so all of this stuff, right? It requires time, money, people, knowledge, and all of that was able to be kind of funneled in at one time. And while pharmaceutical companies and researchers were able to put this together really quickly, that does not mean at all that they took, skip steps for safety or skip steps for making sure that they didn't perform adequate testing. We think about it when they have other vaccines that are in development and they're trying to get people to volunteer to be part of a vaccine trial. Most of us are not even aware that they're happening and that people are looking for them, or they're not jumping up to do it, right? But when we have this global pandemic going on where many, many people are becoming sick, many, many people are dying, we don't know, how things are going to play out. Tens of thousands, of people, hundreds of thousands of people worldwide said, yeah, I'm going to volunteer to do this. So we were able to move all of these things through really quickly. So all of the same steps happened. They were just sped up because we had money, we had an emergent need, and we had people who are willing, to volunteer and help.
Yes, that's a really good way to put it. Some things can take a really long time to study because there's not a ton of interest or urgency around it. But when the entire world is feeling an urgent need to understand something and move a solution through, we can see how much faster things can happen.
Exactly.
Yeah, absolutely. Great. Thank you, Krista.
Sure.
Myth number 2, the vaccines negatively affect fertility. This is something that worries a lot of people.
Yeah, and I can certainly understand that concern. There is no evidence supporting that the COVID vaccine affects fertility at all. What we do know is that the COVID virus, so getting actually the disease or illness from COVID, does not impact fertility. And we do know in some of our control trials that equal numbers of people in the placebo group, so people who did not get a real vaccine, just got like a saline solution, equal numbers of people in that group and the vaccine group became pregnant. So we didn't see this difference. Like if we were worried about it impacting fertility, we would expect to see many more pregnancies occur in the group where they did not get the vaccine versus the group that did. And they were equal across the board. So there's no indication that that's happened. And there's really no biological plausibility for this myth. It just biologically just doesn't make sense for it to impact fertility. And that just has not played out.
Mm-hmm. Mm-hmm. Yeah. Well, thank you for providing a little bit of insight into the clinical trials and how do people look at how the fertility is affected? What are scientists doing so that they can say that? What exactly is happening there? And that they have a control group, and they're not seeing a difference based on the vaccine.
Correct.
And I'm sure longer term and over time, more longer term things will be studied as well. But right now, that is not showing to be true.
Correct.
So myth number 3, the vaccines can cause miscarriages. This is related to people's concerns about children, about having children, about their fertility. What do folks need to know?
Yeah, and this is a really hard one. I'm a mom of 6. So, and I know with, each pregnancy, miscarriage was my number one concern. And I did things like I avoided coffee, I avoided sugar. I did all of these things just to, kind of prepare myself to be as healthy as I could. But unfortunately, I think that this myth is one where I love social media because social media can provide us entertainment and so much good information, but it can also spread a lot of disinformation. And I think this is one where social media either misunderstood or misanalyzed some data to perpetuate this myth. There's no evidence that supports the COVID vaccine causing miscarriages. The seed, and as you kind of alluded to, the follow-up research for these vaccines. So a lot of people think like once the vaccine's produced and made and it's in people's arms that the studies stop. And they don't. Vaccines are studied for years, decades after they're out in the community. And there's three kind of places right now where the CDC and the FDA are monitoring vaccine side effects. So there's VAERS, which is the vaccine, vaccine event reporting system. And then so VAERS is where anybody can report. You could report, I could report, your doctor, a hospital, an insurance biller, anyone can report. It's not set up to look at cause and effect, but it's set up more to look at trends. And so that's one place where they monitor. There's also a new thing that they used for the COVID vaccine called vSafe, which is a handheld, like an app on your phone. So after you get vaccinated, they'll send you a message saying, did you have any side effects? They'll follow up with you a few days later. Did you have any side effects? Have you become pregnant? Were you pregnant? And they'll follow up that way as long as you want to participate, and it goes months and months out. I'm still getting messages from my vaccine in January occasionally, just asking, did you have any issues? Have you become pregnant? Are you planning to become pregnant? Mm-hmm. And then there's also another database that tracks specifically adverse outcomes around pregnancy. So they're tracking stillbirth, they're tracking miscarriages, the number of people who got vaccinated and then become pregnant. And then they're also following pregnancy complications, birth complications, and infants through their first year of life. So they're looking for, infant death, birth defects, developmental delays, anything like that. So there's a robust system in place that is monitoring not only just your kind of all of our possible vaccine side effects, but specifically around pregnant women and babies that are born to pregnant women who had the COVID vaccine. Right. And we're not seeing any trends, any trends or concerns at this time. And you also have to, like, worldwide, millions of people have received these vaccines at this point. So that's the other great thing about providing a vaccine in a pandemic where there's a lot of uptake, a lot of people are getting the vaccine. We get to see those. If there was going to be a bad outcome, we would see those really quickly. Whereas other vaccines get kind of picked up slowly over time because there's not that strong need to get them right away.
Right.
So we're really lucky in that way to be able to look at these outcomes.
Wow. Urgency makes a big difference. Absolutely.
Absolutely.
Absolutely. Melissa says, wow, I think this was in reaction to you having 6 children. So
Yeah, I know. It
Yeah.
surprises me every time too.
There you go. Yes, got a little heart going there for you. And yes, I think a lot of people, they're concerned with all of it. One of the many concerns with all of this misinformation is that children still cannot get vaccinated. And people who have children, even though the parents may be vaccinated, are having to follow a lot of the same protocols as before and have a lot of this, the same kind of danger and fear and sense of anxiety and distress that we've had, even when there wasn't a vaccine, because so many folks are still not getting vaccinated.
Exactly.
Yeah, I don't have children. I really commiserate with how that's affecting, what they can do and can't do right now. It's really hard for them. All right, myth number 4, if you are in close proximity to people who have been vaccinated, it can affect your menstruation. This is kind of another one similar to the same vein, except there was a concern that people who were vaccinated were shedding like people do with a virus. And that can affect the menstruation and affect the fertility of people around them.
Yeah, this is another really a really good I guess good talking point or place thing to talk about. So a couple of things about the COVID vaccine. One, in the COVID vaccine, there is no COVID virus.
Mm-hmm.
So we do have some vaccines that are what we call live virus vaccines that have a weakened form of the virus in it. So that would be like the MMR vaccine for measles, mumps, and rubella. The measles component is a live vaccine. And varicella. So the vaccine that we get for chickenpox is also a live vaccine. And there is some like sort of theoretical risk or very low risk of transmitting like varicella vaccine to the varicella virus to somebody else who wasn't vaccinated, particularly like in severely immune compromised people, things like that. The COVID vaccine has no COVID virus in it. It is not possible for you to shed virus from the vaccine because it simply isn't in there. Mm-hmm. It's a really simple vaccine compared to many of the others. It has the main active component. It'll have the mRNA, which is the messenger RNA, mm-hmm. or the Johnson & Johnson vaccine has an adenovirus, a weakened adenovirus. And then it has fat, sugar, and salt, like my 3 favorite things, all in a vaccine. So it's a really simple vaccine. It is not a live virus vaccine. It is not possible to get COVID from the COVID vaccine.
Mm-hmm. And like you just said, what's in this virus? I mean, what's in the vaccine is not the virus, but also people are concerned about it having fetal cells. So myth number 5 is the COVID-19 vaccine is made of fetal cells.
Yeah. So the COVID vaccine is not made of fetal cells. So just to kind of give a little background, historical fetal cell lines that were derived from like the 1960s and 1970s, from 2 elective abortions, were used to create vaccines for diseases like hepatitis A, rubella, rabies vaccine. And these were obtained electively, and they were not done for the purpose of vaccine development. And I understand that for some people, that's still a really hard piece of information to swallow and goes against, their beliefs. The COVID vaccine does not contain fetal cells. However, some of the vaccines have use the historic line for production and manufacturing. So the Johnson & Johnson vaccine used those lines to create their vaccine, but there's no actual fetal cells in the vaccine. Pfizer and Moderna did not use the fetal cell line to produce or manufacture their vaccine, but they did use in their early phases, they used the fetal cell lines to confirm the efficacy of the vaccine, so how well it worked, and used it all prior to production and manufacturing. So the vaccine that's coming out and going into arms contains no fetal cell lines. So it's really it's a really hard place, I understand, for some people to be. My understanding, and anyone can correct me if I am wrong, is that the Catholic Church has said that that morally it is okay to take these vaccines because of the very distant connection to these fetal cell lines, and because of the just the emergency, sense of urgency that we have to keep people safe. But I understand that that's a really hard one for folks to kind of work through morally, spiritually, emotionally. So,
right. But these do not have them. And that's not like you're not contributing or causing or
correct.
If that is a concern for you, like this is not cooperating with something that you don't agree with in some way.
Yeah. And I'm not advocating for one vaccine over the other, but I would say if that is one of your biggest concerns and the thing that is preventing you from getting vaccinated, then maybe choose the Moderna or Pfizer vaccine, where we know that there are no fetal cell lines used in the production of the vaccine.
That's really good advice for folks. If that's the one thing holding you back, you've got, you have something you can act on. You have some useful advice for you. Myth number 6. You can see how many people have died from the COVID-19 vaccine by referring to VAERS. VAERS is the Vaccine Adverse Effects Reporting System, and Krista talked a little bit about that already. So why is it not quite true that you can see how many people have died from COVID-19 vaccine?
Yeah, so like I said, VAERS is this early warning. It's set up to be an early warning system, and so what it's really primarily looking for is trends or signals, that we might be seeing something out of the ordinary. So for example, when we were concerned about cases of myocarditis potentially related to the vaccines in young people, that was picked up in VAERS. What they saw is we were seeing increased number of cases reported with myocarditis, like outside of what we would normally see. And so they were able to pinpoint that, stop, take a look, examine what was going on, and make recommendations from there. VAERS can be reported by anyone. So I could go in and report an adverse event. Kathleen could go in, and anyone can report an adverse event. And there's not necessarily all of the information that you need in there to make a determination if the vaccine caused this particular thing. It's just not set up that way to monitor cause and effect. What we do also know is that all deaths from COVID anyone who dies within 3 days of receiving a COVID vaccine for any reason are reported into the system. So you could have come in with very bad heart conditions, had a heart attack, but 2 days ago you had your COVID vaccine, you'll get put into the system. Did the COVID vaccine cause your heart attack? Highly unlikely. You are a person who already had, severe health issues along the way. So the problem is that it doesn't mean that the vaccine caused the death. So if you go in there and you look, there's going to be a lot of people die in the US all the time, right? From natural causes, all sorts of things. And a lot of those people are getting vaccinated at the same time, right? Because we're all in the middle of a global pandemic and everybody's getting vaccinated. So you're going to see lots of vaccine deaths around the time of a vaccine that likely are not even connected to the vaccine at all. All of these are investigated and looked into. for, looking for causes of death and where the vaccine might have potentially been implicated. And we're just not seeing that. What the major rare reports they're seeing are occasional like severe allergic reactions, which is a known side effect of any medication. Mm-hmm. So sorry, it was a little convoluted, but it's just not a system that's meant to do that. And so when people, and the data is available to anyone. So anyone here can go in and look at the data and manipulate the data and do what you want with the data. But if you don't really understand the data, your conclusions might be pretty skewed or biased or just completely inaccurate.
Sure. One thing I like to know about I really like to know about how the system works, because in almost every Facebook post that you'll see about the vaccine, you're going to see somebody commenting in there somewhere with the current number from this reporting system. Mm-hmm. And they can say, this is a government system, so this is a hard and true number. This number is super accurate and it's from the people that you trust. So here it is. Here's the hard and fast number. But that's not really the case. Those are not causes of death that have been verified to be caused by the vaccine. Anybody can report an event that, it's not a hard and fast number. It's presented as such. It's presented as this is a hard and fast number from the government on vaccine deaths. And that is just not true. That's not how it works. That's not how the reporting system works. So it is more complicated. And what Krista said, she gave a convoluted reaction, or response, but it's not necessarily convoluted. It's a little bit more complicated. It's complicated. It's just not as simplistic as, and especially not as simplistic as people are making it seem when they throw those comments up there. We have a comment with another one from Aline that I think is really very helpful. So I've been hearing that these vaccines aren't actually helping anyone be protected from COVID-19, and it's simply for the pharmaceutical companies to make money. How would you answer someone who believes in this besides saying that's not true? Like what else can somebody say?
Yeah, I think there's a lot, for some folks, there's a lot of distrust in our big pharmaceutical companies, and for some really very valid reasons, I would say. Mm-hmm. But I think the way I would answer this is, the way I look at it is just take a look around, right? If we're looking right now at the people who are getting sick or severely ill from COVID are the people who are unvaccinated. I can give you a good example in our just even in our household where, there's 8 people in our household, and household transmission is kind of like, this is kind of your highest place of transmission, right? We all live together. We're in each other's space all the time. Prior to 15-year-olds being able to be vaccinated against COVID, two of us were fully vaccinated. The older kids had 1 vaccine on board because they were waiting to get their second dose, and our 2 15-year-olds were unvaccinated. Our 15-year-old son tested positive for COVID, never developed symptoms, but tested positive, as well as his 15-year-old sister. In our household, nobody got COVID, not one person. So the partially vaccinated people, no COVID. The fully vaccinated people, no COVID. And because of my job, we were tested, I had to be tested frequently before I could return back to work. So we were all tested, not seeing it. But we're also just not seeing those numbers right now in Washington State. And I think there's a question later, a myth later on that talks a little bit about whether the vaccine's effective or not. And when we look at the Washington State data around the unvaccinated folks or vaccinated folks getting the virus, it's less than 0.1% of the overall COVID cases between January and June. So it's a tiny, we're not even at 0.1% of vaccinated people getting COVID. The rest of the folks are all unvaccinated or partially vaccinated. So I think it's just this kind of like look around. I don't know how to convince people without the data, but this is what's playing out in real life. The people who are hospitalized are unvaccinated. The people who are getting most severely ill are unvaccinated. And we're going to see vaccinated people get COVID, absolutely. But they're not super sick, they're not getting hospitalized, and they're not dying.
Mhm. Absolutely. A simple way to put it for me is, do we remember the time when we were basically having a 9/11 every single day?
Exactly.
We were having a 9/11 event where 3,000 or more people were dying every single day. And that number has dropped dramatically since people started getting vaccinated. So if folks are kind of, like you said, looking around and following the numbers and following what's been happening over the past year and a half to us, we can see that this is not just a gimmick to sell you something, as maybe some other things might be or what have you. This is not like that. And distrust in government agencies, just general feelings of, oh, people are trying to dupe me, or people are trying to take something from me, and nobody's actually trying to help me. These kinds of feelings are really breeding a lot of the anti-vax sentiment.
Yes,
They really have
absolutely.
been. Yeah. So like we're saying, just take a look at the numbers. Take a look at what's been going on for the past year and a half. Yeah. Thank you for your question, Eileen. That's really helpful. All right. We got myth number 7 now. We have the federal government covered up 45,000 vaccine-related deaths. This is referring to a lawsuit by America's frontline doctors. Speaking of distrust, government distrust, and feelings of cover-ups and lies from authority figures. So, can you explain a little bit about this for people who haven't seen anything about this myth that has been going around?
Yeah, so I think this is actually a perfect example of, again, of somebody using information from the VAERS reporting system inappropriately. So I think, and I did just do a brief reading about this last night. I'm familiar with the America's Frontline Doctors from their push of hydroxychloroquine early on as a treatment for COVID versus getting the vaccine, which is, it's not even a drug that we're using in treatment of COVID patients because it proved to not be effective. But it sounds like what they did is they went into the VAERS system and pulled up some death records, and then looked in some other, there's a whistleblower who has access to some other government databases, and said that, maybe they reported 9,000 COVID deaths, but really it's 5 times that. And then there's some sort of a cover up. And I actually last night was very curious about this and went into the VAERS database and even just tried to replicate like the 9,000 number and was not able to do that. I'm pretty familiar with the VAERS, the data in VAERS and how it works. So I think, I'm not really sure what else to say about this other than this group is not a, recognized, trustworthy source of information. I think it will be addressed and will sort of go away very quickly. I think it's just being misuse of data and is really unsettling, because I can see how I would look at this headline or look at this lawsuit and think there's no way I want to get a vaccine that killed 45,000 people. But the reality is this is just not true. The numbers, I haven't been able to replicate the numbers, and it is just a perfect example of misuse of data.
Right. It's also a perfect use of kind of playing on people's distrust of the government to be a bad faith actor and to try to convince people that something's not happening. I won't go into it, but there have been some YouTubers who are influencers, and they've been approached by marketing companies to say things against the vaccine in their videos and not disclose that they've been sponsored. And these YouTubers blew the whistle on them. If you want to search this up, there's a BBC article on it. You can just search, vaccine YouTuber, influencer, whistleblower, what have you, and you'll find it. It happened this past week. So some YouTubers have been coming out, these influencers, these people who are using media channels to talk to folks, do have bad faith actors attempting to spread disinformation on purpose. I think this is also, another example of that happening. Purposefully
Absolutely.
misusing the data. Yeah, it's very scary. So make sure you're like vetting your information and choose. I know the playing on the distrust of the government does not mean that the other person is therefore trustworthy. So, I mean, because you don't trust the government doesn't mean that anybody who comes along and says something bad about the government is telling you the truth.
Yes.
Yeah.
I
Keep
will
that
say,
in
as
mind.
an epidemiologist, in all of my career and all of my work in doing preparedness work around a global pandemic, this distrust of government and politics playing such a huge role in it was not something that I think we were prepared for.
Mhm.
And I just, I think the thing that I want people to understand is that this virus does not discriminate. It doesn't care where you're from, who you vote for, what religion you are, um, the color of your skin, how much money you have, how much little money you have. It doesn't matter. We're all equal when it comes to the COVID virus. So making sure that I feel very strongly about making sure that people make good informed decisions for themselves. And it's disheartening to hear about, folks who are intentionally trying to spread misinformation or being disingenuous to our community. And oftentimes that's hitting, a lot of our most vulnerable communities.
100%. I think it's not only scary, but it's really unethical, and it is heartbreaking because people are getting hurt, people are dying over this type of thing, and spreading it. We are all responsible for what we're saying. We're responsible for what we're spreading. It does have an effect on people. It affects people's lives. So we all have a responsibility to be careful about that. If you've been seeing a whole lot of myths on the internet, you probably have, or even in your family, share the information. Let's start talking about what myths are popping up. Hit the share button, share it around on your networks right now. Make sure that you keep following us on Facebook. We're Community Health Worker Coalition for Migrants and Refugees. We're also on YouTube as CHW Coalition for Migrants and Refugees. We are also playing excellent music. I can attest is excellent music 24/7 on chwcoalition.org. You can also follow us on Alexa. You can listen to us on Alexa. You just have to tell Alexa to open Los Originales CHW Radio, and we will open up. I believe you can even say it in English, and it's fine. We want to make sure that you remember that we have a vaccine transportation program. We're partnering with Uber. Let's break through the barriers of transportation. Call, or email Jacqueline 206-291-2599 for English or Spanish. If just Spanish, Martha at 240-551-8969. Make sure you spread that information around as well. If this bad information, misinformation, disinformation can get around so fast, but we've got to be keeping the pace with spreading the true information, the helpful information to people to help them with make their best health decisions. Myth number 8. COVID vaccine effectiveness is rapidly declining, apparently due to reports of breakthrough COVID-19 infections in vaccinated people. So this is, folks kind of not really even believing the vaccine is working at all or anymore.
Yeah. So this is another really good one, and I think super timely right now as information is evolving sort of like by the minute and by the day about the new Delta variant that's circulating in the predominant. That's the predominant variant that's circulating in the United States right now, and including in Washington State. So the majority of the breakthrough cases that we've been seeing have been due to the Delta variant. We have access to testing so that we can actually they're able to go in and look at the genome of the virus and tell which variant it is. And so we routinely are testing for that and vaccinated people who develop COVID or become test positive for COVID. A lot of times they're asymptomatic. So this isn't the virus that was circulating sort of at the beginning of the pandemic where we weren't seeing any breakthrough cases. but now we're sort of almost dealing with a whole different beast right now. And so we are seeing some breakthrough cases. And like I mentioned earlier, when we were looking at data in Washington State, so looking between early January and kind of the beginning of July, there were 4.28 million people in Washington State who were vaccinated for COVID. The breakthrough cases were 0.068% of all COVID cases, so less than 0.1%. 81% of those breakthrough cases had some symptoms. Only 9% of that 0.01 were hospitalized. 45 of those vaccinated people died of a COVID-related illness. And of those 41 people, 31 had underlying health conditions. So maybe didn't have a great immune response to the vaccine, because if your immune system's not good, it's harder for your body to create a good immune response. And then 27 of the other 27 were associated with long-term care facilities. So likely older people, already close to end of life, weakened immune systems, things like that. So it's these breakthrough cases are really small. And I mean, almost insignificant in the grand scheme, looking at the numbers. The other thing I will say is a lot of times people determine if a vaccine's good is if it prevents all disease. And that's the ideal, right? Like we don't want any disease. Right. And the COVID vaccine is still really great at preventing any vaccine. It's a good vaccine to prevent you from getting COVID. What it's super great at is preventing you from becoming hospitalized and seriously ill and preventing you from dying.
Absolutely.
So I don't think it's unreasonable or unexpected for vaccinated people to get COVID. Same as we see when flu vaccine. Flu vaccine might not be as great as we want it to be from preventing you from getting flu, but it is really darn good at making sure that you don't go to the hospital and you don't die.
Right.
And for that part of it, the vaccine is holding strong and very effective.
Right. I think the way that this myth also shows up is when people will say, and I've seen this twice just this week, people saying, I can get COVID when I'm not vaccinated. I can get COVID when I am vaccinated. So I don't feel very pressed, or I don't feel a sense of urgency to go do it. The reality is that the amount of risk is dramatically different. They are not the same thing. And to claim that it's the same way, either way, it's the same thing, either way, is just absolutely false. That is not true. And spreading that line of thinking around is spreading a falsehood. They're not the same thing.
It's very dangerous. It's a very dangerous thing to that piece of information or misinformation to spread. I will say the unvaccinated people who are getting COVID are really sick. The vaccinated people getting COVID, you hear either they don't have any symptoms at all, and they only got tested because they were exposed to somebody who tested positive, so they're completely asymptomatic, or they've had 3 days of feeling a little bit bad, and then they're back to feeling their old selves. So it's generally pretty mild. And then some people do get like a good flu, right? But they're not going to the hospital. They're able to stay at home and, treat themselves over the counter and return back to normal life. The folks also who are getting COVID who have not been vaccinated are also at greater risk of having long-term COVID effects. And we see that much more in the unvaccinated people versus vaccinated people. And some of those long-term, what they call long-term COVID or long-haul COVID, those symptoms are pretty debilitating.
They're bad. They're bad. I mean, I don't think anybody likes to have a coughing fit. It doesn't feel good. It's annoying. It's just stressful. And doing it at night, doing that for months on end. Every day. It's a really big hit to your quality of life that's not being taken seriously. It's not the same to be vaccinated versus unvaccinated. It's not the same.
It's not the same illness at all. Absolutely.
Yeah. All right. I think let's go ahead and do one more. Masks are symbolic. and help people feel more comfortable that they aren't doing anything?
Yeah. Oh, masks, the masks, the masks. I think, and we're moving back into, folks being recommended to wear masks, even if you're vaccinated, if you're going into indoor spaces or even crowded outdoor spaces where you don't know the vaccination status of all the folks around you. There was a paper that was published early on where I think some of this, I think there's a different influences coming into this myth. I think there was a paper published early on that said, these masks are not working. That paper has since been retracted from the Annuals of Internal Medicine. And the authors actually wrote that their statistical methods could not determine whether their findings were reliable and from the results of this really small study, and they're uninterpretable. And the study found, because originally that study found that surgical masks and cotton masks did not contain the virus droplets. Subsequent research has suggested that face masks are an effective method at containing the spread of the virus, especially if Kathleen and I are both in a room and we're both vaccinated, or both vaccinated would be amazing, and both masked and socially distanced. Like, those are kind of our three tools that we have to keep ourselves safe. And so the masks act as a barrier to kind of preventing you from spreading COVID, but also from you from contracting COVID. It's important that they're worn appropriately. So they actually have to go over your nose, because all of this is connected to your respiratory system. And I think we're going to just be seeing an increasing cases where we're going to just have to be masking more frequently. And it's the only protection that a good chunk of our population has right now, right? All of those kids 12 and under have no other option except for masking. So it's far more than symbolic. I think politics played a huge role in this mask debate. And I think that's also been confusing to people, because the recommendations around masking have changed over, so many times. In the beginning, they said, don't wear masks. And they weren't saying don't wear masks because they're not effective. They were saying don't wear masks because we don't want all of the population, the community, going out and buying up all the masks, so our healthcare workers don't have access to them. So we had to get our supply of masks up to meet the demand, right? And then they said vaccinated people don't have to wear masks. And that was great at the time when the original virus was circulating, before the Delta variant came into play. And that variant has just proven to be way more infectious than the original variants that we have been dealing with. So when the mask recommendations change, it's not because somebody just changed their mind. It's because we learned new information. And that's how science works. We learn new information and we adjust based on that new information. So if new information came out that masks were no longer needed, we're going to get rid of the masks. But if the new information is saying, hey, we got to add an extra line of defense here, and masking is going to help do that, then that's what we're going to do for now.
Right. I think there was a lot alongside the government distrust, is this not understanding why things are changing, because some folks weren't really following along or trying to understand the science themselves. And so they were just receiving information from what they should do. Like, they just wanted to know, what should I do?
Mm-hmm.
And then when that kept changing, trust was broken. And a lot of that did not get built back up. But no, masks are not symbolic. They never have been symbolic. And they do work. They have an effect. Obviously, surgeons and healthcare workers have always used them because they protect from contamination. So,
Right.
and obviously they do something.
I will say early on in the pandemic, when we were having supplies issues with our N95 masks, all of our acute care, so our patients who are not in the ICU, who are being cared for with COVID, all of our healthcare workers wore the basic procedure surgical mask and eye protection. And I can't even begin to imagine the number of COVID patients that we took care of in our acute care unit.
Mm-hmm.
And this is pre-vaccine.
Right.
We did not have can't say any. We maybe want, like, it's kind of hard to say if it was the community or a patient because it's hard to know. But we did not have transmission from COVID positive patients to our staff who are caring for them. So nurses who are working with these patients for 8 to 12-hour shifts wearing masks. So for me, that's a pretty clear indication that even those basic surgical procedure masks were effective. Now our staff who are taking care of COVID patients are wearing N95 masks or other respirators because they're in supply and we have them.
Right. Exactly. Well, everyone, this has been Krista Rietberg giving us the real scoop because there are a lot of myths out there. One thing I want to kind of drive home is that this is the third installment of this series. So we've talked for about an hour on different myths with 3 different people now, and that's how many different myths are out there running around. And I would say that a lot of this is because there is an interest by some people and some segments of the population to not want to vaccinate, period, at all. And so they will say anything. They will throw out and they'll just lie and say something that's completely not true, or they'll manipulate some information, or they will keep changing their argument and jumping around from one thing to the next, to the next, to the next. And that's how so many different things are constantly popping up. So some people are not really acting in good faith. They're not really wanting to understand. They're just wanting to not get vaccinated and also convince you to do the same. So be careful. Be careful out there. I mean, persuasion's a powerful thing. Some people are pretty good at it. And just keep yourself up to date with information from reliable people who are trying to take a healthcare crisis seriously. Yeah. Thanks for being here, Krista.
So happy to be here. And everyone who's listening, if you're still on the fence or trying to decide, I just want to say, you matter. You matter to your community. You matter to your family. You becoming ill or, even or dying would be a huge, huge loss for all of us. So, the vaccine's there, it's available. Protect yourselves, do what you can to protect yourselves. It just breaks my heart for people to still, kind of be on that fence, about getting the vaccine. It doesn't discriminate. There's no take backs. There's no do-overs once you're sick. And we've been seeing that. I think if you, even in the media where people are like in the hospital saying, can I get the vaccine now? And it's too late. Once you're sick, it's too late. Mm-hmm. And I just don't want anybody to be having those regrets because it is really devastating. And we need to take care of each other.
Yeah. Thank you, Krista.
Thank you for having me. I really appreciate it.
Yeah, thank you. All right. That was Krista Rietberg with some excellent information and a really powerful take-home message that you can't take it back. And this is a prevention, not a cure. So you have to do it before it's too late. If you need help getting vaccinated in the form of transportation, we are here for you. Call Jacqueline or text 206-291-2599. In Spanish, you can contact Martha 240-551-8969. Spread that information around. If folks can't get transportation to it, we've got you covered. We'll pay for your way there. We'll pay for your way back. There's just no reason not to go. And follow us, Community Health Worker Coalition for Migrants and Refugees on Facebook, or also on YouTube. And we have excellent music playing 24/7 on our website at chwcoalition.org. I also want to say thank you to my estrellas. We have Dr. Ileana Ponce, who is always here supporting the station. We have Luis Miguel Ramirez, who is always here supporting the Social Circle. Beatriz Martinez, Carla Fernandez, Cindy Fuentes, Maria Chocorunta, Melissa Lazaro, Aline Roland, and Bill Perez. Thank you all for almost always being here to support the Social Circle. You've been listening to Los Originales CHW Radio. We'll see you next time in the circle. Thanks for listening.